Funding for the Maddy Report is made possible by grants from the Spencer Family, Community Health System, Harris Ranch Resort, Producers Dairy, Valley Children's Healthcare, and The Wonderful Company. Additional support provided by from the Maddy Institute, the Public Policy Institute for the Valley's public universities. This is the Maddy Report with Executive Director of the Maddy Institute, Blake Zante.
Welcome to the Maddy Report. I'm Blake Zante, Executive Director of the Maddy Institute. Today we'll be discussing the changing landscape of California's childcare with Caroline Danielson, Vice President of Research and Senior Fellow, and Patty Malagon, Research Associate at the Public Policy Institute of California. Thank you, Caroline and Patty, for joining us today. I really appreciate your time.
Thank you.
Well, let's dive right in. Caroline, the child care system aims to provide early learning to low and moderate income children, as well as ease hardships for parents. With a variety of subsidy programs available to help families afford care, can you explain some of these programs and how they work?
Yes, so California's big programs are overseen at the state level by both the California Department of Social Services and the California Department of Education. At the local level, they're implemented by counties, school districts, and nonprofits. The biggest programs are what are called alternative payment programs that enable eligible families to use a voucher to pay for care with a provider whom they select. And there are also childcare spots at programs like State Preschool and Head Start. And Head Start does get its funding from the federal government, but it's similar to State Preschool in some other aspects. And the newest program that California has is the Transitional Kindergarten, or TK program, for 4-year-olds who attend through their local schools.
And Patty, the article that you authored mentions a study that reported full-time costs of preschool care is 6% to 18% of median household income across California. With this infant care is 8% to 28% of median incomes. Can you talk more about how these subsidies make childcare more affordable and lessen the economic pressure on families?
Yeah, and I'll start off with saying that, these pressures look different for families across the state. If we look at inflation adjusted rates, we find prices in San Francisco County are more than double the prices in Tehama County, which is a northern rural county in California. And for example, infant care at a center is about $29,000 in San Francisco versus $13,000 in Tehama. And child care is more expensive in higher income areas of the state, but costs or child care costs are a higher share of family incomes in lower income areas. But yes, as you mentioned, subsidies do help families across the state. And in this report that you're mentioning, we did focus groups where we heard from families that subsidies make care more affordable, and parents expressed that subsidized care allowed them to return to work without worrying about the high cost of childcare, and this resulted in greater financial stability as they could keep more of their income for other essential needs.
And another follow-up, Patty, for you. In order for families to receive subsidized childcare, providers must be willing and able to navigate the subsidy system. How difficult is it for providers to navigate these subsidy programs, especially when they use multiple funding sources? And are there additional programs that help providers navigate the system?
Yes, providers often do need to combine funding from multiple programs to support their full day year-round care. And these funds are used to support, the same children across multiple classrooms and provide services or equipment and supplies. And when combining funds, providers must meet the requirements of the more stringent subsidy program. And they also need to carefully track how each funding source is used to comply with individual program or program reporting criteria. And family home-based providers also must meet, or both centers too must meet licensing requirements that vary depending on the age of children in care. And these include staffing ratios. So at a center, it's 1 adult per 4 infant children. And there are also different training requirements that providers need. And we did ask navigators in our survey for their perspective on providers' experiences serving families who pay out of pocket or pay tuition and fees directly versus those receiving subsidies. And about half said that providers receive payment more reliably through this subsidy program or programs, but navigators also sensed that providers had a greater administrative burden serving families under the subsidy program.
Thank you. Up next, we'll discuss the improvements in child care affordability, but also the steps that still need to be taken. This is the Maddy Report. Welcome back. In the last segment, we talked about the public programs that have been established to help families afford childcare and give children the opportunity to have early learning. Over the past decade, we've seen state and federal funding triple, and with this many improvements in affordability, why don't we start with you, Caroline? What role do expanded subsidies and publicly funded programs play in reducing the share of household income families spend on childcare?
Yes, I wanted to say that's accurate. We've seen a trend towards increased funding for subsidized care in California, and a couple of notable facts about that are that federal funding increased temporarily during the pandemic, and it was a pretty big increase. But when those temporary funds expired, the state has contributed more to keep the total funding at roughly level at its new higher level. And a second important point is that the state has been increasing the amounts paid to individual providers for subsidized care. So not just growing the number of providers, but also increasing reimbursements for providers. And because of these expansions, families should be seeing some relief from what can be, as Patty mentioned, quite high costs.
And Caroline, a follow-up for you. Public investments in early care and education have nearly tripled over the last decade. But despite this, many eligible children still aren't served. What factors contribute to this persistent gap in service delivery?
Yes, well, it's expensive, and others' research indicates that at this point, the highest shares of children served are preschool aged. It makes sense because we have both state preschool and now TK that serve this age group. And TK is actually California's only universal program for preschool aged and younger children, meaning it's all available to all 4-year-olds without cost. Other programs have both eligibility rules, typically around income and parents' employment, and they have caps as well, meaning that all eligible families can't be served. However, the state has in recent years added to the number of available spaces and programs. Between 2021 and 2024. It added about 130,000 subsidized spots to its roster of about 250,000 spaces. And there's plans to add about another 100,000.
And Patty, before we go to a break, a question for you. How do escalating living costs such as housing, labor, and operating expenses shape the long-term sustainability of childcare providers? And what risks does this pose for families who rely on these services?
Yeah, that's an important question. And in our report, we asked or heard from providers in focus groups and along with families, that they did feel the pressure of rising costs in California, and providers emphasized that the need for these reimbursement rates that Caroline is talking about to keep pace with the cost of living and financial demands of operating their programs. For example, providers noted that with higher rates, they are able to recruit and retain staff. And the state has made efforts to address these concerns. And over the past decade, statewide inflation-adjusted subsidized rates, or the rates that providers are being paid, have increased by 22% and now average around $1,700 per month per child. And again, Caroline mentioned in response to the pandemic, there were several rounds of additional payments and stipends that were issued to subsidized providers. And since 2024, there have also been additional monthly payments known as the cost of care plus rate payments that have been supplementing these payments to licensed and license exempt providers. So the state also will be implementing a new or projected to implement a new way of setting rates in January 2027. And of course, a big question is, are these increases enough to create sustainability for providers in the state? And while in our work, we've seen some signs that the market is relatively healthy, PPIC will continue to monitor these trends closely.
Thank you. We'll be right back after this break. This is the Maddy Report. Welcome back to the Maddy Report. Another expansion of childcare has been the establishment of transitional kindergarten, or TK, which has grown in recent years. Why don't we start with you on this one, Patty? How has the expansion of TK really reshaped the mix of early care and education options available to families in California?
Yes, that's a great question. And in our report, we found that there have been an increase in available childcare slots due to this like expansion in TK, but we also found that the number of children ages 0 to 4 has also been decreasing for the past decade. So it's important to know that, or know or emphasize that while the number of childcare spaces has grown due to the expansion of TK, the population of young children in the state has also been declining. And in our survey, we asked navigators or professionals who help connect families and providers about, the impact of TK, and they reported that the expansion of TK was shifting the ages of children they were being asked to place in care. So they noted an increase in requests for toddlers and infants.
Despite the TK programs growing, many parents continue to have questions and concerns about participating in TK. How does a lack of clear and accessible information about TK options, eligibility, program structure contribute to confusion among families deciding between TK and maybe other forms of care?
Yeah, I think it's important to note that TK's been actually around for over a decade, but with the expansion since 2021 to serve all 4-year-olds, it's certainly a new program for some families, in fact, many families. And the childcare landscape is simply complicated. It's an important decision for families as well, so it's not surprising that families have questions. In fact, recent PPIC research by my colleagues have found that take-up of TK in recent years has dropped from 83% in the 2018-19 school year to about 70% in the 2023-24 school year. And I think that represents some of the increased concerns and the newness of the program for some families when their children are newly eligible. The biggest drop was actually among Latino students over the past 5 years or so. In our research, we heard in focus groups that parents had concerns about class sizes and whether the classrooms would be appropriate for 4-year-olds and whether the hours of care were enough to meet family needs, particularly for working parents. Some of these questions I think will resolve as parents grow more familiar with the TK options in their area. And in other research, my colleagues at PPIC have found that school districts have been working on the issues of appropriate facilities for 4-year-olds and the appropriate curriculum to help them learn. So those issues on the school district side are also being addressed and will, I think, lessen some of the current concerns over time.
And Patty, with the expansion of TK, some navigators and providers have felt that children are leaving subsidized programs for TK. However, there are many children enrolled in both TK and subsidized care. Can you explain more about why parents chose to do this? And also, does this dual participation reveal the gaps in coverage?
Yes, and I think Caroline touched this on briefly in the previous question, but yeah, I think the number of hours of care provided is one critical factor for families when they're selecting a program. Other PPIC like qualitative work suggests that families maybe are enrolled in both programs and TK to piece together sufficient hours. And in our survey in this recent report, respondents told us that children they also found were enrolled in both TK and subsidized care. About 70% said that some children were, and 15% said that a lot of children were enrolled in both programs. And I think, just to reiterate what Caroline brought up earlier, is that parents may choose to combine programs to align with a full day of work for families.
Thank you. We'll be right back to wrap up our conversation with Caroline Danielson and Patty Malagon. This is the Maddy Report. Welcome back. Caroline and Patty, thanks again for joining us on the program today. Before you go, I'd like to continue our discussion about the changes in California's child care programs, improvement, and what still needs to be done looking forward. As California continues to expand both subsidy programs and TK, what key steps need to be taken to ensure that these investments reach all eligible children and families equitably? And Caroline, we'll turn to you on this one.
Sure. I think it's important to continue to listen to the voices of the families, the providers, the navigators, the school districts, and the schools that all help the system to work. The system needs to be affordable and accessible to families, and it needs to be sustainable to providers in order to work well. For example, in our research, we heard strongly that TK is really changing the childcare landscape. It's providing an affordable option for families, but it's also changing the business model for childcare providers. And there are different trends across the state, so the solutions are also different depending on where you live. So continuing to listen to those voices, and as the system is adjusting, be ready to address the needs seems quite important. And we also think that from our research perspective, to have an adequate bird's eye view, we believe that further integrating data across this complex landscape that spans both educational settings and childcare settings will be helpful to monitor changes and be able to take appropriate action to address any problems that are cropping up.
And Patty, what additional guidance or information could be provided to both families and childcare providers to help them better navigate available programs, funding options, and the expansion of TK?
Yeah, like Caroline mentioned, the childcare landscape is shifting in California. TK is still expanding, and families in our focus groups express concerns and the lack of information around TK. And I'll just mention too that, however, we also heard that parents are turning to other families to learn about programs or supports in their community. And our survey did find that with the expansion of TK and other factors, infant care versus preschool care is more difficult to find. And this also, could highlight a potential need for better information and guidance for families on how to locate care options and how to combine programs that align with their needs, and connecting families with local resource and referral agencies. Navigators can make this process easier. And on the provider side, one area of need is also just understanding all of the shifts, including TK, and how this could shift the age composition of children that they serve, and providing adequate resources and trainings on how to adapt to these changes could be valuable. And also, as more families participate in programs, they share their experiences with other families, and new families tend to seek out providers that have been recommended by people they trust. So that's one, I think, big part of childcare, that people want to know their children are safe and well cared for.
Thank you. And lastly, Caroline, looking ahead, what lessons from the recent decade of expanding childcare can help guide future policy decisions to strengthen California's childcare and early education landscape?
Yeah, it's been 5 years just about since the state released its master plan for early learning and care, and it had goals in that master plan of streamlining and unifying and expanding the system of care. And since then, we have seen some sizable changes. We've seen the expansion of TK, we've seen the addition of subsidized childcare slots, and we've seen increased payments to subsidized providers. And there's, I think, as we've been indicating, more changes to come. We are in the data, we're also seeing, as Patty mentioned, encouraging signs of increased capacity of licensed providers, although we do see some variation across the state. And as she also mentioned, we're seeing a shrinking child population, which does leave a smaller gap between capacity and potential need than would otherwise be the case. But within these large changes, there are still issues to address. As Patty noted, affordable care for younger children is something that parents and navigators have mentioned is harder. We've also heard in our research that for children with special needs and for families who need non-traditional hours of care, for example, on the weekends or in the evenings, it can be harder. I would also just mention that we have plans to continue research in this policy area, and our recent report focused on affordability and sustainability. Our upcoming work is going to look more in detail at children and parents' experience of subsidized childcare and how it varies across the state, and we hope to be able to inform policy efforts going forward with that research.
Well, Caroline and Patty, thank you both for joining the Maddy Report today. It was great talking with you, and really appreciate you being on the program.
Thank you.
Thank you.
Thank you for tuning into the Maddy Report. To learn more about the Maddy Institute, visit themaddyinstitute.org. What makes a community thrive? How do we bridge the gap between government and policy and the people it impacts? The Maddy Institute was founded to answer questions like these, to create a link between government and the citizens it serves, and to inspire a new generation of leaders dedicated to public service. In 1999, the California legislature unanimously established the Maddy Institute in honor of former California State Senator Kenneth L. Maddy, Senator Maddy was widely respected for his commitment to bipartisan solutions and his dedication to the people of California's Central Valley. Known for his ability to work across the aisle, Senator Maddy believed that effective government begins with respectful dialogue, evidence-based policy, and a commitment to the common good. Today, the Maddy Institute continues his legacy. Our mission is threefold. 1, to promote more effective and inclusive government. 2, to encourage civic engagement. And 3, to conduct research on key issues impacting the Central Valley. Through these efforts, we aim to educate, inspire, and empower the next generation of public servants and community leaders. One of the most impactful ways we fulfill this mission is through our internship programs. Each year, the Maddy Institute provides opportunities for students from the Central Valley to work in legislative offices, both in Sacramento and Washington, D.C., as well as local government agencies. These internships give students real-world experience in policymaking, allow them to see government in action, and help them build the skills they need to make a difference in their communities. But the Maddy Institute isn't just for students. Through our civic engagement programs, we create opportunities for everyone to participate in the political process. From community forums to workshops, we bring people together to discuss important issues facing the Central Valley, like water management, air quality, economic development, and education. These events foster open dialogue, allowing citizens to engage directly with policymakers, experts, and others, creating a stronger and more informed community. And to ensure the public stays informed, the Maddy Institute produces the Maddy Report, a weekly public affairs broadcast that covers the latest issues impacting California. Each episode features interviews with lawmakers, journalists, and subject matter experts, providing insights and analysis on topics that matter to our region. Whether it's understanding new legislation or exploring solutions to local challenges, the Maddy Report is a trusted source of information for those who want to stay engaged. At the heart of everything we do is a belief that good governance requires an informed and engaged public. From nurturing young leaders to fostering dialogue, the Maddy Institute is dedicated to creating a future where the people of the Central Valley can thrive. Join us as we continue Senator Maddy's legacy. Together, we can build a brighter future, one informed and engaged citizen at a time. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.com.